Okay, because I'm about to get ready for work.
Okay, so it'll record chapters 3 and 4, whatever we get through here.
Okay, thank you so much.
You're welcome. Okay, so for chapter 3, can you guys see it?
Yes.
Yes.
All right, so primary objectives of the nurse are to promote health, illness, and restore health, also to help the patient cope with illness, disability, or death. All right, so we're focusing on this in all patient populations, okay, in both health and illness. Health is more than just not having the illness itself. It's actually that person being able to move back towards their maximum potential. So remember, we talk about being able to put the patient back to their previous level of functioning. The person-centered holistic healthcare addresses a lot of dimensions in that area. The nurse has to understand and respect each person's definition of health and their response to illness. Okay, and you should be familiar with the different models of health and illness. So health is the state of complete physical, mental, and social well-being, not just the absence of the disease. Illness is your response to that disease, okay? The abnormal process or that change in your level of functioning. And disease is pathological changes that occur in the structure or the function of either the body or the mind. Wellness means that we're healthy and we're living a lifestyle that promotes good physical, mental, and emotional health. And then morbidity is the frequency of the disease. Mortality refers to the number of deaths that occur because of that disease. So acute illness, short onset, lasts only a few days, things like appendicitis, pneumonia, diarrhea, or a common cold. Chronic illnesses are things that last a long time, slow onset, and might have periods of remission or exacerbation. And examples would be things like diabetes, COPD, emphysema, arthritis, lupus, those kind of things. For the illness to be considered chronic, it has to be a permanent change. So it's going to cause permanent changes, or there's going to be alterations in the body's anatomy or physiology that are going to be permanent. It requires a special patient education for rehabilitation and requires a long period of care or support. So that's why we're talking about things like diabetes. It's going to last for a lifetime, okay? It's not going away anytime soon. COPD, emphysema, those kind of things. Once that person becomes ill, there's certain stages that you have to be able to identify. You are going to see this on exams, and it's called Setchman's stages of illness, okay? Setchman's, that's the author. So it's called The Stages of Illness by Setchman. The behaviors talk about how people cope with the altered function in the disease process. And they're unique to each person. They can be influenced by things like age, gender, family values, economic status, educational level, and their developmental level. So in stage 1, the person is going to experience symptoms, but they don't consider themselves sick yet. Now in stage 2, they assume the sick role and they start to focus on the symptoms and the bodily function. In stage 3, they assume the dependent role. This means they do something like they go to the doctor and the doctor says, oh, you got diabetes. And they agree and they decide to join the doctor and follow the prescribed treatment plan. In that stage, they're in the dependent role. And then 4 is recovery and rehab. So like someone was in the hospital, they accepted the dependent role while they were in the hospital, they took the prescribed treatment. Now they're being discharged to the nursing home where we're going to do rehab for this MI or whatever. We're going to do a long term to help them recover or get back to that previous level of functioning. So that's going to be where stage 4 comes in. All right, so stage 1, they might have cold symptoms, but they don't say that they're sick. In stage 2, they have the cold symptoms and they're calling the doctor and saying, oh, or they're calling the work and saying, oh, I'm sick, I can't come to work today. I'm too sick. So stage one, first indication, okay, is recognizing that they have this symptom. Pain is usually the most common, okay? Other symptoms would be rash, fever, bleeding, or cough. They're gonna last by a long time, but for a short time, and the person can often relieve those symptoms on their own. But if they don't relieve the symptoms on their own, then they go to the next stage, which is stage two, and they assume that sick role. And now they start to focus in on the symptoms, okay? So now they might try over-the-counter medications, they might go to the doctor, all right? But they're gonna do something to try to address those symptoms. Three, they're actually going to a doctor or to a clinic or some kind of provider, okay? We're gonna get another opinion. That person's gonna get them some sort of treatment based on the diagnosis, and the person is going to carry out that treatment or accept it. And then four, again, is that recovery and rehabilitation stage. It may start in the hospital, but generally, if it does start in the hospital, they're gonna end up long-term in a skilled facility or at home to complete that recovery. A person who is experiencing a productive cough and fever and takes a sick day to recuperate and decide whether to make an appointment at the doctor is said to be in stage three.
False.
What stage are they in?
Two.
Two.
Good. A person who defines himself as sick and medicates or visits the doctor is in stage two. A nurse calls the unit to report having the flu and not being able to come to work. What stage of illness is she exhibiting?
Assuming a sick
Assuming
role.
sick role. B.
Good. When assuming sick role, the person identifies themselves as being sick and seeks validation from others. An older adult patient was recently diagnosed with vascular dementia. Because the client lives alone and has poorly controlled hypertension, the client has begun to receive home health care. The new aspect of the client's care is characteristic of which stage?
The Pender, hold on. Receive that. Is it the?
Is it A?
I like A.
I think it's the dependent rule. Yeah, A.
Good. Okay, because now the reason why this isn't 4, okay, is because they have newly diagnosed hypertension and that's what they're being seen for. Okay, so they're accepting the fact that they have this hypertension and that they're going to get care for it. Everybody understand that? They're not recovering. Like they weren't in the hospital and got treatment for this now, and now they're home recovering and getting rehab. A hospital nurse assesses clients in various stages of illness. Which statements accurately describe client responses to illness based on Suchman? So which ones of these are true? Read them all out.
B is true. B, D, and E.
Okay, everybody agree with that?
No, not D.
Not D?
Hold on. All right. Social diagnosis and follows prescribed treatment. See. Oh yeah, it is. Okay.
So D is actually wrong, okay?
It's wrong, right? Ain't that accepting dependent role or something like that for D?
D is stage 3, not 4.
3. Yeah, 3.
Oh, when they go to rehab, it's not stage
Well,
4.
the whole statement's not true though, and this is what you have to think about. So in select all that apply, we never clump things together. Everything in the statement has to be true. So here's your problem with D. When the client
Oh,
decides
accepting
to
a
accept the
diagnosis.
diagnosis and follow a prescribed treatment plan, they're in stage 3. When they achieve recovery and rehabilitation, they're in stage 4. So there's actually 2 stages represented here in this statement.
Yeah, I see it
It's
now.
wrong. E is correct, right?
Yes.
Mhm.
Okay, and B is correct. C is also correct.
How about E? Hold on. Stage 1
E-
pain.
E is correct. I said C is correct, and also B.
B. Okay.
Right. A is stage 2. Okay. And D is a combination of stage 3 and 4. I didn't highlight these, but those are the correct ones. Okay. B, let's just highlight them so we have them. Oh, it's not going to work here probably because I'm not in my regular mode, but it would be B, C, and
E.
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 Okay, B, C, and E.
E.
A nurse is caring for a client who has breast cancer. This client tells the nurse, I don't know why this happened to me. I'm ready to move on and do whatever I need to get healthy again. This client is in which stage of acute illness?
Is it 3?
Yeah, 3. They're ready to go into that dependent stage, right?
Yes.
Right.
Good. So Healthy People 2020 defines health equity as the attainment of the highest level of health for all people. Health disparity is defined as a particular type of health difference that is closely linked with social, economic, and environmental disadvantages. Meaning that if I live in a certain neighborhood, I'm going to have more access to health care, certain doctors. If I have a certain amount of money, certain insurance, I can get treatment over someone else who doesn't have access to that health care, either because they don't have it in their community. Look, they're even talking about this now with the COVID shot, right? How many are hearing about it? So what's going on with the COVID shot is it's being made accessible to people that are over 75 that have certain compromised issues. But if you're African American, you're more exposed to that issues at the age of 60. So because you're between the ages of 60 and 75, you're not getting put on that list of needing that shot, because the list is social injustice. All right, social injustice with that list. Injustice, I don't know, might not be a word. Social injustice, okay? Because they're not offering that shot to the same population. In other words, you have just as much risk from the age of 60 to 100 as someone of my cultural or ethnical background would at 75 to 100. But because you're not 75, you're not going to get offered that shot. But you should be getting it offered because you have just as much risk as the person that's white and 75. So I don't know if you heard about that in the news, but it is going on where there are certain populations that are not getting access to the shot that should be. Another issue could be like, you know, they build clinics up in certain areas, but not others. All right, so where are you going to see these disparities? All right, it happens among the racial, ethnic, and also with people that are obese. You'll see a lot of people act funny towards people that are obese. They just make stereotypes about them. And also people that are different genders. So a lot of those things will play a part. The person's educational level, their developmental level, their sexual orientation, okay, because men will take information differently and use it than women will. Health insurance, access to healthcare, and then age, because age plays a big part on it. When you're in the middle ages and a little bit older, you're more worried about being sick and healthy and being unhealthy and dying. But when you're 15, 16, 17 years old, even 25 years old, 30 years old, you're not worried about dying. As a matter of fact, you think you're really not really at risk for dying, right? You don't consider yourself at risk for dying at 30 or 20 years old. I could do all kinds of things. I could even drink, get totally drunk and drive. And I still don't consider myself at risk for driving at that, or risk for dying at that age, because it's an age thing. I don't feel vulnerable to death. The nurse working in the community assigned to the care of several clients. The nurse recognizes which clients are more likely to experience barriers to access for healthcare. So who would most likely find some sort of barrier if they were trying to get healthcare? So we know it's not going to be a student entering a local university. They're going to have access, right?
Yeah. B.
Okay, B, a migrant worker who works on the farm. Okay.
D.
D, a person unemployed. Okay.
And C.
Okay, I like C
C.
too.
Yeah, C.
Okay, good. So it was B, C, and D. So regardless of age, gender, level of education, religion, sexual orientation, ethnicity, social position, or wealth, everyone's entitled to equal services. Disparities are going to be more common among racial ethnic minorities, migrant farm workers, those with gender differences, older adults, people with disabilities. So what kind of things affect our health and illness? Our basic human needs, okay? Those have to be met, all right? Human dimensions. So our health beliefs, our health practices, what we believe is going to help us. And we use the nursing process to help plan and care for the patient and evaluate what type of care. This helps us provide individual holistic care for these people. Self-concept, this can influence the way a person sees health, okay? And also it talks about how that person feels about themselves and the way they perceive themselves. So it has a lot to do with their self-esteem and their body image of themselves. Also how they're able to react to different types of stress or illness. Risk factors for illness or injury. That can increase the person's chance for illness or injury. So we have to take risk factors into consideration. Sometimes risk factors are modifiable, like smoking, and sometimes they're non-modifiable, like a family history of something. All right, so we're gonna modify the risk factors that we can when we can, and when our patient allows us to help them relate to that disease process better. All right, and when we can't, then we can't. But there are some risk factors that we won't be able to modify in these cases. And so we have to know which ones we can and which ones we can't. Because that's gonna help us determine what kind of game plan we're gonna have for this patient. All right, other things that affect the patient's health are the physical dimension. So, we talked about all this stuff: genetics, developmental, race, gender, emotional dimension. If they're not mentally healthy, that can affect their ability to heal or to cooperate with treatment. Intellectual dimensions. So do they have the cognitive ability? Do they have the educational background? What's their experience in the past been like? Do they have trust? Environmental dimensions, okay? Do they have access to housing, to air and food and water that are contaminant free? How about the social dimension? Okay, so economically, are they stable? What type of lifestyle are they living? What are their family values and culture? And then what are their spiritual beliefs and values? Because if they have beliefs that interfere, their spiritual beliefs that interfere with certain types of healthcare, that could affect them also, or the healthcare that we can provide to them. So we look at the person as a whole person. When we talk about holistic, we look at all these things. Their intellectual capability, their environmental factors, their physical factors, their spiritual factors, their emotional factor, their socio-cultural factors. We look at all these things. Health promotion and illness. So you guys should be familiar with this. So primary is aimed at promoting health and preventing disease. So examples of promoting health would be immunization clinics, family planning, poison control. Secondary health promotion, okay, would be screening for diagnostic tests like mammograms, vision, dental exams, medical exams. And then tertiary starts after the person already has the illness. They've already been diagnosed and treated. And now we're working on developing those disabilities and helping them achieve their maximum level of functioning. So for tertiary people with diabetes, we might teach them how to recognize and prevent complications. Somebody with physical therapy, we would teach them how to prevent contractures. And somebody with breast cancer, okay, we might refer them to a support group or for additional help once we remove the breast because of cancer. Models of health and illness. I've seen many questions on this, so I would probably know this. The health belief model, the health promotion model, the health illness continuum, and the agent host environment. So the health belief model, this talks about how people perceive what they believe to be true about themselves and their health. So it doesn't matter whether I'm in good health or not if I perceive myself as being of good health. I will modify factors for health, including demographic, social, psychosocial, and structural variables. So based on 3 components, I'm looking at these variables to see what my perception of the disease is. So I look at myself and I look at the environmental stuff and this demographic stuff around me, and I determine myself whether or not I'm susceptible to that disease. Or I might look at myself and determine to myself, like, how do I feel about the seriousness of this disease? Do I personally take it as a serious disease? And then the benefits of action. The health promotion model, this is used to determine how people interact with their environment as they try to pursue health. So they incorporate individual characteristics and experiences with behavior-specific knowledge and beliefs to try to motivate health-promoting behavior. They consider personal, biologic, psychological, and sociocultural factors, and these are predictive of certain health-type related habits. So the health behavior itself is the outcome of the model, and it's directed towards attaining positive health outcomes and experiences throughout the lifespan. And then the health illness continuum. This talks about how a person's level of health is conceptualized. It views health as a constant changing state with a high level of wellness and death being on opposite ends. So you're either extremely healthy or you're near death. All right, and it talks about the dynamic, ever-changing state of health as the person adapts to changes in both the internal and external environment, trying to maintain this state of well-being. The host agent environment. This views the interaction between the outside agent, the susceptible host, and the environment as causes of the disease in the person. So we have this agent, we have this host who's at risk, okay? And then we have this environment, and all of them are conducive to this person getting this host into the body that's going to cause some kind of issue. It's a traditional model and explains how certain factors can put people at risk for the infectious disease process. And 3 factors are constantly interacting, and the combination of those factors can increase the risk for development. This model use is limited when dealing with things like non-infectious diseases. So in the agent host, again, we have this agent, we have a host that's susceptible, okay, and a reservoir. You know, can this agent get into my body somehow and cause me to become ill? What risk factors do I have to think about that may cause me to become ill? So my age, for one. As I get older, I'm at a higher risk for certain things because of the process of the body. Like my vital capacity is not as good as it used to be because my lungs are not quite as elastic. My respiratory muscles don't work as well. So I'm at an increased risk for things like respiratory infections. I'm also at an increased risk for things like urinary tract infections because of changes going on within the urinary system. If I'm a baby, I'm at risk for certain types of infections in the beginning stages of life because my immune system is still immature. Genetic factors. So things that I've inherited can put me at risk for certain illnesses. Physiological factors. What else is going on in my body that could put me at risk for an illness? And then health habits. How do I engage? And how is that going to affect my health? If I'm not eating healthy, if I'm drinking and drugging, if I'm not getting proper rest, those kind of things. And that also can be incorporated also with lifestyle. So smoking, drinking, and then the environment. What kind of factors am I exposed to in the environment? Smog, if I work in a plant where there might be chemical exposure, those kind of things. How are they going to affect me? So the public health is measured by morbidity. Remember, that's how frequently a disease occurs. So right now, we're measuring the morbidity of COVID, right? And we're also looking at the mortality because we're looking at not only how frequently it's occurring, but how many deaths are being caused by it. Wellness is an active state facilitated by lifestyles that promote good physical, mental, and emotional health. Disease is a pathological change that's going to change the structure or the function of the body or the mind. And illness is the response of that person to the disease. Illnesses can be classified as either acute or chronic. Remember that acute is going to have a sudden onset, and chronic is going to be things that last a long time, like diabetes, COPD. Several factors, okay, can lead to healthcare disparities. So you already know sexual orientation, disabilities, educational level, mental health, age, race, ethnicity, poverty, and biological sex. Our basic human needs and human dimensions will influence how we respond to health and illness. Health promotion itself refers to the person's behavior that is motivated by their desire to increase the well-being and health potential. Examples of models of health promotion are illness prevention. And illness prevention include the health belief model, the health promotion model, the health illness continuum, and the agent-host environment model. A lot of nurses have initiatives that help underserved populations, okay? And they want to go out there and help these underserved populations. So they will advocate for their patients in certain communities. A rapid onset of symptoms that last a short amount of time indicates which condition?
Acute.
A 48-year-old client was just diagnosed with type 2 diabetes mellitus. The client has a body mass index of 35 and leads to a sedentary lifestyle. The nurse informs the client of risk factors for the diagnosis and the need to change the diet and exercise behavior. Which client statement indicates the need for further teaching?
C.
C.
A,
C.
C for sure. All right, I want to say that the rest of this PowerPoint is questions. I could go over the questions or we can go to chapter 4. We got a few more minutes. What do you guys want me to do?
Chapter 4.
Because you have these PowerPoints, right? You have access to these questions. I sent them to you, so you should have them.
That's the ones you sent to us before, right? Or you sent another email?
No, these are the ones that I sent to you, the PowerPoints.
Okay, then I have them. So, I mean, whatever everybody else wants to do, I'm fine with.
Oh, stop it. My screen's not being cooperative. Let me just. There we go. There we go. Oh, come on. Why isn't it letting me? I don't understand.